welcome back to In the Gray Area with REVV Health. I'm Brittany.
And I'm Travin.
And today we're going to talk about a hormone that you don't hear very often, but is really important for most women to understand, progesterone. And we also have Lisa back with us today.
So excited to be here with you guys again.
I'm really excited to have you back today. One of the things that we hear constantly is women don't quite understand why they necessarily need to be taking progesterone.
So progesterone is one of those hormones that is a very calming hormone. And for women, if we're low on progesterone, then the estrogen is more predominant and we get a lot more of the effects of estrogen, which can make us feel pretty miserable, especially around the time of our periods with increased PMS, heavy bleeding, irregular periods, breaking out around your period, trouble sleeping. So there's a lot of things that progesterone helps kind of moderate estrogen's effects. So it's very symptomatic if you don't have enough progesterone.
And typically, like most women don't, right?
Yeah, I mean, there is those who have, ultimate hormones, right, that don't have a low progesterone. But there's a lot of women who have PCOS, which is a very common hormonal imbalance and disease process that actually causes you to be deficient in progesterone and have a lot of those symptoms. So.
And we're seeing like 2 out of 3 women typically have PCOS, which is huge.
Yeah, it's pretty incredible. There is a lot of misinformation out about PCOS. Some providers believe that, PCOS is only diagnosed if you get an ultrasound and there's a bunch of cysts on the ovaries, but there are numerous different types of PCOS. Some of it is adrenal hyperplasia, and some of it is actual cysts. So everybody, kind of puts all of these patients into one category and says this is what PCOS is, and it's not. It's a whole combination of a lot of different diagnoses. But
yeah, and I think that a lot of times we also see there's definitely a huge issue with insulin resistance too, when we're seeing really low levels of progesterone and even inside PCOS as well.
Mm-hmm. So what happens with that is along with PCOS, patients get elevated testosterone and low SHBG or sex hormone binding globulin. And so it leads to a lot of other problems because it disrupts kind of all of the hormones.
Yeah.
It's kind of considered diabetes of the ovary.
I know a lot of times we see that it's even passed down generation after generation. My grandma has it. My mom has it. I have it. Both my daughters have it. And looking back, it's pretty crazy because I had really, really heavy periods early on. And the first thing they wanted to do for me was put me on birth control at such a young age. And then same thing with my daughters as well. So it's been pretty incredible just kind of mixing in the progesterone with the thyroid support and how much it's helped right off the bat just with cycles and stuff. But I know that for me personally, there was a point where I did have a cyst on one of my ovaries and I had never had one before. And all of a sudden then they're like, oh, well, maybe you do have PCOS after all.
Right.
Which apparently I'd had my whole life pretty much. And that was kind of what drove my interest in PCOS and learning more even about adrenal hyperplasia. But to find out that it was more of an insulin resistance of the ovaries thing was kind of mind-blowing to me. I have never heard that before.
Right. Well, and part of the issue too is it's been so underdiagnosed. So a lot of patients that I see that have the lab work that indicates that they have PCOS, and I ask them about their family history. They're like, no, there's no PCOS in my family. And I'm like, okay, did any of your family members have a hysterectomy? And a lot of them will say, yeah, my mom was bleeding so bad that they finally just did her hysterectomy. And that's oftentimes what they'll do is they'll first try birth control pills. And if that doesn't work, then their next recommendation is to get a hysterectomy. So we're kind of just putting a Band-Aid on the problem and not fixing the underlying problem at all. So it's really sad, all these women who've had hysterectomies because of hemorrhaging, basically, and they could have just been on progesterone.
And that's the exact thing they wanted to do to me, too.
Yeah.
Now that you just said that, I remembered. And I actually went down and did an ablation instead of, because I was like, no, I don't want to do that. But now that you said that, I totally even forgot that they pushed that on me, too. And I was 35.
Yeah.
So, yeah, crazy.
Mm-hmm. Yeah, we see so many young girls even with come in, like you had said, that they're treated with birth control. And that's where we see a lot of issues, like Lisa had said earlier. A lot of times it's insulin resistance, and we see like these really low SHBGs on these women. But some of the girls that are put on birth control that have like the synthetic estrogens, it'll actually drive the SHBG up really high. And that's when it can kind of be a bit daunting when we're treating them. And if they still are on that birth control, like with testosterone, for example, that's when we really, really have to push the testosterone level like really high to overcome that. But it's so hard for people to get their head around, seeing those numbers, but trying to explain to them like, look, the only way we're going to get your free testosterone high enough is to bring your total high, but because you have such high SHBG because of the synthetic estrogens in your birth control.
It's pretty crazy just to look at the changes patients go through once we start getting them on progesterone. You have to be really patient because it can cause some irregular bleeding as the body is trying to get adjusted to it and starting to actually ovulate like it should be. And so patients get kind of frustrated because their periods become irregular, but it's just part of that trying to switch everything and get it back into the right cycle. So.
Yeah. I think that's what's important about just, communicating with those patients up front, just to kind of set the expectation that they know that. And I think it's a lot easier when they kind of anticipate that than if they're caught off guard.
Yeah. We had one of our patients who has been working with us for a while, but then she got off of birth control. And then all of a sudden her cycles were all over the place, and she's freaking out because she's having a cycle like every 12 days, every 14 days. And then when we started like even peeling it back, she'd been on birth control for 20 years. So that's a long time that you're on those synthetic hormones and suppressing them. And then you're introducing these other bioidentical hormones, and it takes time, sometimes like a year to fully regulate.
I think there's a lot of questions about the difference between synthetic hormones and bioidentical. Do you want to touch on that, Trevin, at all?
Yeah, I mean, that's probably one of the big misconceptions. I think, a lot of people think it's kind of a buzzword or a marketing tool that people use, but I mean, it actually is completely different hormones when you're talking about something that, mimics what your body naturally produces versus something that's made from, horse urine or a synthetic progestin that like your body completely metabolizes and processes totally different. And, the outcomes aren't expected. That's what can cause a lot of these bad side effects and even, increase in cancer risk and things like that. So there truly is, a difference, and you can call it what you want, whether it's bioidentical or natural hormones, but it's something to, if you're looking for getting your hormones replaced or fixed, like, and you're working with a provider, like that should definitely be one of the first things that you ask them if they utilize synthetic hormones or, bioidentical natural hormones.
Yeah.
And definitely, progesterone that comes in your birth control pill is much, much different. It's norethindrone, much different than progesterone. And it does kind of inhibit our ability to optimize hormones when people are on birth control pills. So we do recommend IUDs or other forms of birth control other than oral birth control, because oral birth control just really disrupts the normal hormone cycles.
Yeah. And the IUD, right, is more of a localized release, right, rather than a systemic. And so that.
And we always just recommend only if you're absolutely using it for birth control reasons, not to try to help regulate your hormones, because we see that a lot, to where even some people will come in with an IUD and they're on the pill as well. That kind of stuff is so sad. Maybe you could just kind of even talk about the difference between commercial grade and then the compounded bioidentical, because I know personally, even like working with a lot of our female patients, sometimes they get to where they're balanced and regulated, and they're like, oh, well, I talked to my doctor, and my doctor is going to now prescribe me the same things you are doing. And I spend a lot of time trying to explain the difference between what we actually do and what they can get from their PCP, and how insurance actually doesn't cover what we do and why.
Yeah, it does. It all comes full circle to this whole concept of wanting your insurance to pay for everything. And like we say time and time again, like your insurance is not going to cover your wellness care. And when you said it, they're not going to cover compounded medication, but when it comes to hormones, especially capsulated hormones, the commercial products are not micronized. And they say that they're micronized, but really they're just compressed through a filter. And so basically when we talk about micronization, it's, making the particles of the hormones so small that they can actually enter your cells and do what they need to do. It's more of like when you think of like a hormone that's truly micronized, it's more of like a dust or like a really fine powder versus like a pharmaceutical product. It's more clumpy, right? And so you can imagine that's much harder to do what it's supposed to do. But So when you're taking it, your body's not going to absorb it nearly as much. And on top of that, like progesterone, for example, I think the highest concentration it comes in is 200 milligram capsules. And we know a lot of women need much more than that to get adequate, hormone saturation from progesterone. And then on top of it, that 200 milligrams is probably equal to maybe less than 100 milligrams of the compounded progesterone that we use. So when patients say that, oh, I'll just have my doctor get it for me, or I'll get it through a commercial pharmacy, it's not going to be enough typically for what you need.
Also with some of those other commercially available, you can't adjust the doses easily. It's not as flexible when it comes to that. And also there can be some fillers and other additives and things in the capsules that inhibits your ability to absorb them as well. So
That's right.
when we're looking at sources for our progesterone, we're making sure that it's going to be a well-absorbed capsule because otherwise you may as well not be taking it.
Yeah, that's right. And we verify this time and time again through lab work, and we can see that, how well our patients absorb the products. And we've tried like throughout the years, many different pharmacies, and there's a huge difference.
Yeah, huge difference. And I know that personally.
Yeah.
Especially with absorption. One of the first things I did notice, I know, was sleeping. So, and that's something I think that most all of our patients really do see first, like when they start the progesterone, is that they're sleeping better and that they're having more of that deep sleep.
Yeah, I think that's kind of the first benefit that people notice with progesterone, especially my menopausal patients who have been waking up 2 or 3 times a night due to hot flashes and night sweats. And actually, like, they're finally getting enough sleep where they're actually dreaming and remembering their dreams, which is one of the first things to go is when you're not sleeping well, you can't remember your dreams and you just aren't dreaming. So it's really cool to see that effect come almost first. Some of the other effects take a while to notice. It may be 3 to 6 months before we get their cycles regulated or some of the other benefits of progesterone, but sleep is one of the first ones. Pretty cool to see.
I must be sleeping really well because my dreams are crazy.
That's a good sign.
Yes.
Yeah.
So one of the things I see often, you probably do too, is that people come in and they're like, oh, I'm on an estrogen pellet or I'm on estrogen cream and stuff, but they aren't on any sort of progesterone either.
Yeah, so the scary thing about taking estrogen without progesterone is it increases your risk of uterine cancer. And so progesterone is very important in decreasing your risk of cancer. Progesterone mediates estrogen, basically. It limits the thickness of the uterine wall. If that gets too thick, or what's called hyperplasia, where it gets really thick, then you're going to have really severe, heavy periods. But also you're at increased risk of having uterine cancer from that. So anytime you're on any kind of estrogen or estradiol, you need to be on progesterone, whether you have a uterus or not, because you can have some uterine cells in other places, like endometriosis. So you could get cancer. And the problem with some of the topical progesterones is they don't absorb enough to be able to offset that and make that estradiol safe. So it's really important to have adequate progesterone levels if you're on estradiol supplement.
Yeah, that's great info.
That's so well said. I think that's very important for listeners to hear because, I mean, we have seen, like you said, several times where women come in and they're on a testosterone estrogen pellet with no progesterone at all.
Yeah, I know. We have a really good friend that called me one day. I was working out at the gym and he was like, I need to talk to you. My mom was just diagnosed with breast cancer and stuff. And he's like sending me all the hormones she was on. And she was on like testosterone pellets, and then they are doing estradiol pellets. And then she was on like 200 milligrams of like slow release commercial grade progesterone. It's like my heart sunk.
Yeah.
And like,
Yeah, the important thing is just getting that follow-up because everybody absorbs progesterone differently too. So we might have one patient who's on estradiol and just taking 200 of progesterone, and they're doing fine. And we'll have another patient who their progesterone level, even though they're on that much, is in the toilet. And so they're really increased risk of having endometrial cancer and not even knowing it because they are taking progesterone. So it's super important to get those levels checked and make sure that it's adequate.
yeah, extremely important when on estradiol.
Yeah. And don't take the slow release progesterone. Like you said, your body does not absorb that. So that's not going to be enough to give you protection.
And really, you're not going to get the benefits of
Mm-hmm.
the improved sleep and decreased hot
That's right.
flashes and night sweats and things like that. So,
Yeah. I know, too, for me, I felt like, testosterone helps a lot with like mood and everything like that. But with taking the progesterone, that enhanced my mood tremendously. I feel just more like at peace and calmer and easier to like even handle stressful situations,
Mm-hmm.
which is really helpful because there's many times for years that you just sometimes feel like you can't even control your emotions or feelings and your hormones are just crazy.
well, and that's the point of progesterone. So it peaks at ovulation, and then it has another surge right at the time of when you start your menstrual cycle, when you start bleeding. And it's that calming part so that you don't have severe PMS. So if your progesterone is too low, you get really, can I say, catty at the time of ovulation, and then again, the week before you start your period. So the point of progesterone is just to relax us and kind of mediate the effects of estrogen. So if you have estrogen dominance, you're going to have increased bleeding, bloating, blemishes, breast tenderness. So really, and I can't say, well, I'll say bitchiness too. So you really need the progesterone to just kind of level out female emotions.
Yeah.
So
So a lot of times we hear the word estrogen dominance, but sometimes really it's just a deficiency, especially in progesterone.
exactly, that's exactly what it is. So our body doesn't make too much estradiol.
Yeah.
It's just that our body doesn't make enough progesterone.
Yeah, because that's things that we even hear a lot of times with men and women is the fear of having too much estrogen. So,
And estradiol is different than estrogen, and certainly estradiol is super healthy for men and women. It's the estrogen that we're getting through the creams that we're applying on our skin, through the plastic bottles that we're drinking from, through all of these environmental kind of toxins,
Yeah.
is where we're getting the estrogens. So
Testosterone and in the visceral fat too. And I've heard Dr. Rouzier joke a few times when he talks about estrogen dominance, and he'll say kind of tongue in cheek that he treats estrogen dominance with estradiol. And what he means by that is that the estrogen dominance, a lot of it is from the visceral fat producing too much of the estrone, like you said. And we know that estradiol is one of the hormones that is very beneficial at reducing visceral fat. And so it's kind of the joke he makes, but it's true in a roundabout way. But the estrogen dominance isn't necessarily a thing. It's something that gets thrown around a lot. But you said it right on.
yeah, estrone and estradiol are two completely different things. And that's another thing that we're sometimes seeing here at REV is once we start optimizing women's hormones and they start losing weight, they can feel kind of crummy at first because their fat tissue is releasing all of that, the estrones. You're getting rid of all those toxins that estrogens kind of store in the fat. And so as you're losing fat, you're kind of releasing that. And so initially, you can feel a little crummy before you start feeling better when we're kind of optimizing things. So.
Yeah, very true.
is there anything else that you feel like the listeners need to know in regards to progesterone?
Yeah, I think for me personally, it was the sleep. The sleep was amazing. I think my husband would say the mood stability probably is good, kind of things being mellowed out a little bit more.
Yeah.
And just feeling like I'm more back to my old self that I was. I don't have PCOS, so I never had to deal with any of that when I was younger. It was just as I entered menopause that I started having those symptoms. So kind of getting a taste of what other people have felt maybe most of their life with their progesterone being low. So overall, just feeling a lot better than I have in a lot of years.
That just reminded me of something. We just got our youngest patient yesterday, like at 12 years old. She has PCOS, and she started her cycle when she turned 10 years old. So she's been dealing with this heavy cycle, and poor thing, her emotions are all over the place and stuff. So it'll be incredible to see just adding this progesterone into her life, how much it's going to change and help.
And it's amazing how much earlier women are going into menarche, which is your first period, and it's becoming more and more younger. That's not right. So it's becoming younger, and it used to be that younger than 11 was considered too early, abnormal. And now some girls are starting their periods at age 8, which is kind of wild. So yeah, it's just all the environmental toxins and things that we're coming into contact with, things that are added to our food, hormones that are added to our meats. All of those things are impacting young girls and boys.
Well, I think I'll mention real quick too, just for the guys real quick, that progesterone is not something that guys should take. And I know it's it can be tempting because you hear about like, oh, well, the sleep benefits and it's calming. And I even know that there's some clinicians and even in some of these clinics that do prescribe progesterone for their men, right? But we know it's highly inflammatory in men. It can cause like severe sexual dysfunction. And so I think, as long as you're optimizing your DHA, your pregnenolone, your testosterone, like you're gonna make enough progesterone that your body needs. It needs very little as a guy. So don't take progesterone.
If you're feeling any of these symptoms that we spoke about today, I just want to let you know that you're not alone, you're not crazy, and that progesterone might be something that you really need to look into. And if you haven't got your hormones tested, I would highly recommend doing so, whether it's with us or somebody else. If you are interested in getting your labs done, you can go to REVV.Health and go to Start Now. If you're a female, just click on women, and men, click on men, and we'd be happy to help you and help answer any of the questions that you might have. Thank you for joining us today, and we will see you next time.